One of the guiding principles of high-reliability organizations, HROs, is fostering a culture of safety. Leaders and staff must work jointly toward performing as highly effective frontline teams. These well-trained operational teams repeatedly scan their environments for emerging problems, constantly communicate information across team members, and swiftly adapt to changing demands. Continually learn through structured debriefs and real-time collaborative problem-solving. Defer to those with the most expertise, regardless of hierarchy. Drive safety culture from the bottom up by maintaining mutual respect and trust, holding one another accountable for speaking up about safety risks, and quickly adjusting to contain these risks. In order to achieve this, the military health system adopted high-reliability organization guiding principles and assembled a set of evidence-based strategies called the Leadership Engagement Toolkit. These have been successfully used in healthcare settings across the nation. These strategies should be implemented using a sequential approach to meet your local organizational needs. Implementation of all of the strategies will likely accelerate your transformational change toward high reliability. One specific strategy used to ensure frontline teams are equipped with the tools they need to foster a culture of safety is teamwork training and skill building. Here are a few key reasons why teamwork training and skill building is necessary in your organization. Care has become fragmented, demanding successful team communication to prevent system failures. Organizations are treating sicker patients with treatments that are becoming increasingly complex. Failure of teamwork and communication has been consistently cited as a primary root cause in approximately 65% of Sentinel events reported to the Joint Commission. Realizing the importance of teamwork training and skill building, the military health system utilizes a specific program called the Team Strategies and Tools to Enhance Performance and Patient Safety, also known as Team Steps. This program was developed jointly by the United States Department of Defense Patient Safety Program and the Agency for Healthcare Research and Quality. Team Steps is an initiative designed to change how your teams work together on an ongoing basis. A Team Steps initiative occurs in 3 continuous phases. The first phase is assessment. It sets the stage by determining organizational readiness for the initiative. In this phase, you will create a change team, the leaders and key staff who will drive the initiative. Identify a specific opportunity for improvement that could be accomplished through better teamwork. Formulate a vision for the initiative. Use site assessment tools to determine if the necessary leadership support, information base, and resources are in place. Phase 2. Planning, training, and implementation. Decide what to do and make it happen. This phase is where planning and execution take place. Develop an action plan specifying what will be done during the initiative. Conduct training, implement the tools and strategies selected, and test the intervention. Phase 3. Sustainment. Make it stick. This phase is designed to sustain and spread the improvements in teamwork performance, clinical processes, and outcomes throughout the organization. Users will integrate teamwork skills and tools into their daily practice. Monitor and measure the program's ongoing effectiveness. Develop an approach for continuous improvement and spread the initiative throughout the unit or organization. It's not just about the training, but about providing sufficient time for teams to continue to practice the teamwork tools and strategies in their daily work. For example, it's important to have a change agent who leads periodic meetings for a few months after the training to discuss how the team is performing and using the tools. In order to successfully implement and make Team Steps work, here is what leaders will need to do. Clearly define the need. Identify a specific opportunity or issue that is to be worked on. Communicate why this initiative is important throughout the organization. This need should be something that requires a teamwork solution, such as improving communication between nurses and physicians, ensuring everyone on the care team knows the plan. Align this initiative with other ongoing initiatives so it is not another new program, but an integral part of achieving the vision. Focus on enhancing teamwork and establishing a teamwork and safety culture. For team steps to be successful, leaders need to establish a culture of teamwork and safety so that it's not just a training program that staff go to, but a new way of working together. One of the powerful effects of this program is that it can reinvigorate a staff's sense of pride in their profession and love of their work by providing them with tools to enhance their performance and increase patient safety. Staff need to be willing to work together to communicate, question each other when appropriate, and back each other up. Senior leadership support. Senior leaders need to be involved, visible, and active in their support of teamwork. Senior leaders need to model the teamwork behaviors and skills that we want the staff to adopt. Identify a champion for this effort, someone with high credibility in the organization to lead and support the effort daily. Allocate sufficient resources. Appropriate time, personnel, and funding is needed to establish the Team Steps program, conduct the training, and then follow through on emphasizing the importance of teamwork in our daily work. For example, this means identifying trainers and coaches, providing an infrastructure to support training, allowing time for staff to attend training, including nurses, physicians, and key personnel, providing time for coaches to meet with staff members on an ongoing basis. This may require some creative thinking. For example, how do we provide the opportunity for the team to attend training and still meet our target hours? How do we ensure that we have time to spend in team meetings in the future? Measure success. Continually evaluate whether the process is achieving the outcomes anticipated. If success is measured, it can then be publicized to celebrate as well as further spread the buy-in for the process. Processes can also be modified based on lessons learned along the way. Reward and reinforce teamwork. Since a teamwork and safety culture is needed for Team Steps to be a success, it's important to reward and reinforce teams for engaging in teamwork behaviors and learning teamwork skills. Successes need to be formally recognized and showcased throughout the organization. Leaders, champions, trainers, and coaches should be willing to provide ongoing feedback to others within the institution. And those are the basics for implementing the Team Steps program within your organization. Let's do a quick review. In order to develop highly effective frontline teams, the military health system uses the Team Steps program for teamwork training and skill building. This practice facilitates teamwork, which is directly related to preventing adverse events. For this practice to be successful, leaders must take an active role by setting the expectations, modeling those expectations, supporting the Team Steps program, and monitoring its use. To find more information for implementing Team Steps in your organization, you can visit the Team Steps website. We encourage you to consider how you can use this practice at your facility to create highly effective frontline teams who use teamwork to create a culture of safety, moving it one step closer toward the goal of becoming a high-reliability organization.